In this video, we'll demonstrate about the practical skills biochemical test interpretation. Cholesterol is a vital structural component of cell membrane and a precursor to steroid hormones and vitamin D. Yet, in excess, it's a primary driver of atherosclerosis. The normal reference range for serum cholesterol is 3.65 to 5.2 millimole per liter. The results can be interpreted by the following: hypercholesterolemia, normocholesterolemia, hypocholesterolemia. Hypercholesterolemia, high results, can indicate risk of atherosclerosis. Normocholesterolemia is normal value. Hypocholesterolemia, low results, often points to liver disease and malnutrition. Triglycerides are a lipid form of stored energy. Circulating in the blood, they reflect dietary intake, metabolic health, and are independent marker of cardiovascular risk. The accurate measurement is vital for a complete lipid profile. The normal reference range for serum triacylglycerols is typically 0.5 to 1.8 millimole per liter. So the results can be interpreted as follows: hypertriacylglycerinemia, normotriacylglycerinemia, hypotriacylglycerinemia. Hypertriacylglycerinemia, high results often indicate metabolic syndrome, diabetes mellitus, and cardiovascular risk. Normotriacylglycerinemia indicates normal value. Hypotriacylglycerinemia, low results, often points to malnutrition and malabsorption syndromes. Urea is the end product of amino acid metabolism, which is formed in the liver and excreted by the kidneys. Its concentration in the blood is a sensitive indicator of renal function, hydration status, and protein catabolism. The normal reference range for serum urea is 2.5 to 8.3 millimole per liter. The results can be interpreted as follows: high levels of urea, normal levels of urea, and low levels of urea. High levels of urea indicates kidney problems and dehydration. Low levels of urea indicates liver disease and malnutrition. Bilirubin is a yellow lipid soluble end product of heme catabolism, primarily from hemoglobin breakdown. The insoluble unconjugated undirect bilirubin is transported in blood bound to albumin. The liver conjugates it via UDP glucuronylyl transferase into water soluble conjugated direct bilirubin, which is excreted in bile. Intestinal bacteria subsequently convert it to urobilinogen, which undergoes enterohepatic circulation and is oxidized to cercobilin, responsible for stool color, and urobilin, contributing to urine color. The normal range is 3.5 to 20.5 micromole per liter. Jaundice is classified into three types: prehepatic, hepatic, and posthepatic. Prehepatic, also known as hemolytic jaundice, results from excessive red blood cell breakdown, hemolysis, as seen in malaria or sickle cell disease, often leading to elevated unconjugated bilirubin. Hepatic, also known as hepatocellular jaundice, occurs due to liver damage from causes like viral hepatitis or cirrhosis, impairing the bilirubin conjugation and excretion, which raises both conjugated and unconjugated bilirubin. Posthepatic, also known as obstructive jaundice, arises from a blockage in the bile ducts, for example, gallstones, tumors, which prevents the conjugated bilirubin excretion and causing a buildup of conjugated bilirubin in the blood. The liver conjugates indirect bilirubin via UDP glucuronylyl transferase into water soluble conjugated direct bilirubin, which is later excreted in bile. The normal range for direct bilirubin is 2.2 to 5.1 micromole per liter. Posthepatic obstructive jaundice arises from a blockage in the bile ducts, for example, gallstones or tumors, preventing the conjugated bilirubin excretion and causing a buildup of conjugated bilirubin in the blood. Potassium is the dominant intracellular cation, maintaining a vital 25 to 1 concentration gradient between the interior of cells and the plasma. This gradient is fundamental for nerve transmission and muscle function, particularly cardiac contraction. The normal range for potassium is 3.5 to 5.5 millimole per liter. The results can be interpreted as hyperkalemia or hypokalemia. Hyperkalemia most commonly results from renal failure, tissue breakdown, or excessive intake and is a medical emergency. Hypokalemia is often caused by Conn's syndrome, renal or gastrointestinal losses, or inadequate intake. Sodium is the dominant cation outside our cells. It's the body's primary osmotic particle, meaning total body sodium directly determines extracellular fluid volume. Sodium balance is maintained almost exclusively by the kidneys. Excretion is fine tuned by adjusting the filtration rate and, crucially, by hormonal control of tubular reabsorption. Aldosterone acts to conserve sodium, while HCl natriuretic peptide promotes its loss. The normal range of sodium is 130 to 150 millimole per liter. The results can be interpreted as follows: hypernatremia or hyponatremia. Hypernatremia is less common but serious. It almost always reflects a deficit of water. It can be from insufficient intake or pure water loss in diabetes insipidus, even hypertonic fluid loss. Hyponatremia is a low serum sodium and is often more common. Clinically, we must determine if it's due to true sodium loss from kidneys, gut, or skin, or dilution from excess water retention. Amylase is a secretory digestive enzyme primarily produced by the pancreas, P type, and salivary glands, S type, that hydrolyzes polysaccharides. The normal range of amylase is 16 to 30 gram per liter per hour. A marked elevation in serum activity is strongly indicative of acute pancreatitis, salivary gland problems, intestinal obstruction, or a perforated ulcer. Urine amylase measurement primarily reflects pancreatic P type amylase, which serves as a valuable diagnostic tool, especially for pancreatic disorders. The normal range of urine amylase is 28 to 160 gram per liter per hour. Elevated urine amylase primarily indicates pancreatic injury or inflammation. For example, acute or chronic pancreatitis or pancreatic duct obstruction. Alpha 1 globulins are serum proteins which are primarily synthesized by the liver and consists of several important glycoproteins that function as key acute phase reactants, primarily consisting of alpha 1 antitrypsin and alpha 1 acid glycoprotein. The normal range of alpha 1 globulin is 2 to 5.5 percentage. The results can be interpreted as follows: high levels or low levels. High levels increased is common in acute inflammation and chronic infections such as rheumatoid arthritis, lupus, and some cancers. Low levels decreased often indicates alpha 1 antitrypsin deficiency, which can cause severe liver damage or lung disease. Alpha 2 globulins are a group of proteins which are produced by the liver, which acts as a crucial acute phase reactant, transport molecules, and enzyme inhibitors in blood plasma. They play key roles in inflammation response and blood clotting. primarily consisting of haptoglobin, ceruloplasmin, and protein C. The normal range of alpha 2 globulin is 6 to 12 percentage. The results can be interpreted as follows: high levels, low levels. High levels often indicate conditions such as acute or chronic inflammation, infections, autoimmune diseases such as rheumatoid arthritis, or even cancers. Low levels can indicate liver dysfunction or kidney dysfunction, such as nephrotic syndrome. Beta globulins are a group of liver produced plasma proteins which includes transferrin and LDL that act as carriers for iron, lipids, and hormones while supporting immune function. The normal range for beta globulin is 8 to 15 percentage. The results can be interpreted as follows: an increase or a decrease. An increase often indicates iron deficiency anemia, a compensatory increase in liver synthesis to improve iron utilization. A decrease often indicates a liver disease, reduced synthesis, or nephrotic syndrome, urinary loss, or even in chronic inflammatory states, tumors, or malabsorption, such as gastroenteropathies. Gamma globulins or immunoglobulins, such as immunoglobulin G, immunoglobulin A, or even M, are essential blood proteins which acts as antibodies to identify and neutralize pathogens, providing critical immune defense. It is produced by plasma cells in the lymph nodes and spleen. The normal range of gamma globulins is 11 to 22 percentage. The results can be interpreted as follows: high levels or low levels. High levels, hypergammaglobulinemia, can be polyclonal, such as infection, chronic inflammation, or liver diseases, or even monoclonal, such as multiple myeloma. Low levels, hypogammaglobulinemia, often suggest underproduction, potentially due to leukemia or genetic immune deficiencies. Creatine phosphokinase is an enzyme found in the heart, brain, and skeletal muscles that act as a vital energy regulator. It catalyzes the conversion of creatinine and ATP into phosphocreatinine, storing energy for tissues with high demand, such as muscles. There are three isoenzymes: CKMM, primarily found in skeletal muscle, CKMB, primarily found in the heart, and CKBB, primarily found in the brain. The normal range of creatine phosphokinase in males is 25 to 200 units per liter, and in females, 25 to 175 units per liter. An elevated CPK often suggests damage to muscle tissues such as skeletal or cardiac. It is a key diagnostic indicator for myocardial infarction, such as heart attack, and rhabdomyolysis due to strenuous exercise or physical injury. Total protein in the body is a key health indicator. It reflects body nutrition, immune system activity, liver, and kidney function. The normal reference range for serum total protein is typically 65 to 85 gram per liter. So the results can be interpreted under hyperproteinemia, normoproteinemia, and hypoproteinemia. Hyperproteinemia, high results, can indicate dehydration or conditions like multiple myeloma. Normoproteinemia is normal results. Hypoproteinemia, low results, often points to malnutrition, liver disease, kidney disorders. Uric acid is the final metabolic product of purine, which is a nucleic acid component. The normal range of uric acid in male is zero point 0.2 to 0.41 millimole per liter, and in females is zero point 0.2 to 0.34 millimole per liter. Uric acid and its salts, urates, have low solubility in water. When their concentration increases, they readily crystallize and aggregate. This is the direct cause of gout, kidney stones, urate nephropathy, and hyperuricemia. Glucose is a fundamental monosaccharide which acts as a fuel for every cell, especially the brain. Its concentration in the blood is tightly regulated. Deviations can have immediate and serious consequences, such as diabetes mellitus. The normal reference range for serum glucose is typically 3.65 to 6.11 millimole per liter. The results can be interpreted as follows: hyperglycemia, normoglycemia, hypoglycemia. Hyperglycemia, high results, can indicate diabetes, Cushing's syndrome. Normoglycemia, normal value. Hypoglycemia, low results, often points to insulinoma, inappropriate sugar drug management, adrenal insufficiency, and sepsis. Lactate dehydrogenase is a cytoplasmic enzyme found in nearly all tissues that reversibly catalyzes the conversion of lactate to pyruvate. Its clinical utility comes from analyzing its five isoenzymes LDH1 to LDH5, which are formed by different combinations of heart and muscle subunits. These isoforms have tissue specific distributions. The normal range of lactate dehydrogenase is 225 to 450 units per liter. The tissue damage or cell death causes the release of LDH and its isoenzymes into the bloodstream. Elevations in the LDH5 suggest injury to the liver or skeletal muscle. A rise in the LDH1 biomarker often indicates heart muscle damage. Aspartate aminotransferase is an intracellular enzyme found in high concentrations in the heart, liver, skeletal muscle, and kidneys. It catalyzes the amino acid metabolism and is released into the bloodstream upon cellular injury. The normal range of AST is 0 to 40 units per liter. Elevated AST levels is a sensitive but less specific marker of tissue damage, often requiring correlation with clinical context and other tests to determine its origin. For example, myocardial infarction, hepatic injury, or muscle damage. Alanine aminotransferase is the enzyme primarily found within liver cells, hepatocytes. Its psychological role is to catalyze the transfer of an amino group from the amino acid alanine to alpha ketoglutarate, a key step in amino acid metabolism. The normal range of ALT is 0 to 40 units per liter. ALT is a crucial biomarker for hepatocellular injury. When liver cells are damaged or destroyed, for example by viruses, toxins, or ischemia, ALT is released into the bloodstream. Albumin in the blood is a key health indicator. It reflects nutrition, liver, and kidney functions. The normal reference range for serum albumin is typically 35 to 52 gram per liter. The next slide, should I go slow? No. The results can be interpreted as follows: hyperalbuminemia, normalbuminemia, and hypoalbuminemia. Hyperalbuminemia, high results, can indicate dehydration or hemoconcentration. Normalbuminemia is normal values. Hypoalbuminemia is low results, often points to malnutrition, liver diseases, and kidney disorders. Hemoglobin is the essential iron containing protein in red blood cells, responsible for transporting oxygen from the lungs to tissues and aiding in carbon dioxide return. Its structure is a tetramer composed of four protein chains, two alpha and two beta chains. The normal range of hemoglobin in males is 130 to 170 gram per liter, and in females 120 to 150 gram per liter. The results can be interpreted as follows: an elevated hemoglobin level or a decreased hemoglobin level. An elevated hemoglobin level often occurs in conditions where red blood cell production is excessively stimulated, such as in the diseases polycythemia vera or in compensatory responses to chronic hypoxia, for example, living at high altitudes, and even some cancers. Decreased hemoglobin level often defines anemia. There are several types of anemia, such as iron deficiency anemia, folate B9 and B12 deficiency anemias, and sickle cell anemia, and etc.